So as always, if you could introduce yourself before you ask the question. So we have 1, 2, 3, and 4 for now, and then I'll take the others, so I don't forget. So I think it's Santiago.
Thank you all for very nice presentations. I would have questions for all, but I don't want to monopolize the question period. So for Raghi, it's quite remarkable to show that informality among salaried workers is falling. As you showed, is really quite remarkable. And you did mention something, but maybe you could elaborate about, is the real minimum wage what's happening there? And do you have data that could support that? Or is it kind of the revolutionary period around the time in which Mubarak fell and something else happened? Or I don't know, could you say it a little bit more? And if you can identify it or not with respect to changes in the real wage? Thank you.
Thank you so much. So I have like three small questions. One, when we talk about the reallocation due to climate change, and the question is, what is the cost of that reallocation? How they substitute? Is it the consumption that they really substitute? And if not, what is the trade-off that they are really looking for? And who actually move out of the first location to another? And what were the key intention behind the relocation? Is it some kind of employment or something else? Because when we talk about the beneficiaries, there is less intention to work more, and that kind of intention would really hurt them. Coming to this question of how this informality and would lead to the cash transfer, basically, we are trying to do an analysis about the unconditional cash transfer on this, the employment nature. What we found, especially for the female, that they have substituted their unpaid jobs with the more of paid work. Whether we call this paid work is a more of some kind of farmer work or not. And the way we are thinking to explain this issue is because now they have the access to information as well as some kind of linkages with the market when they are going market for getting funds and something like that. And that give an idea about them because they feel they become more productive and more value their time. So this kind of substitution from one sector to another sector would be an idea about looking how this informality would lead to a more of formality. I'm not comfortable how we can use this a proper definition of formality, but the kind of substitution that they have would give us some idea about the substitution. So the last comment on this, the cash transfer and the labor market. You know, there is a study by RIMA that there is no labor market effect and there is no layoff. But the question related to this is, when someone is graduated from the program, like after getting 3 year, 5 year, 10 year, the step, where is the shift? Either they continue the next level of education or they switch to the labor market. If they continue to the next level of education, probably there would be no impact. But if there is a kind of shift, and they are dropped from the education sector, probably then you would have to look into the way where they actually absorbed in the labor market. Thank you.
Thank you. I'm Hai Anh Dang, a senior economist with the World Bank. Yes. Thank you very much for very, very, very interesting presentation. So I have this question for Raghi and Yasuda, right? Yes. Okay, so, you know, I just wonder, you know, if poor households, you know, are sufficiently, you know, like protected against, you know, like on the risk, you know, given the current social protection setup, you know, in Egypt and also, you know, around the world, right, as you review the global events. And also, you know, I suspect that, poorer household, right? They are much disadvantaged, and they are not, cover, as much as they should be, right? But then in that case, if that is correct, then could you quantify a bit, the gap between poor households and richer households? And say in terms of budgets, in terms of, the state budgets, in general, do we have some number, say we can come up with some number to suggest that, say if the poor, they receive, this much, then perhaps they will be better, cover, and especially during, like a time of crisis, like the recent, COVID-19 pandemic. Yeah, thank you.
Okay. We had a question, gentleman there. In the side, yeah.
I'm André de Koster from the University of Leuven in Belgium. I have a question for the last paper of Nerivia. Have you thought about the underlying structural factors which could produce a result? In old times, we would first have modeled theoretically a structural model or something like that, and then go to the empirical testing of the hypothesis following from that model. Now it's very interesting to see this good empirical work, but maybe you should look at other outcomes or other maybe generating factors of the non-outcome on the labor market. So have you thought beforehand on the underlying structural mechanisms which could produce a result of this child grant on later labor market outcomes?
Thanks. We can take more questions. I have two at the back and then we'll come to the front. So let's take the two at the back first.
Hi, Tim Kohler from the University of Cape Town. Great to see two of my colleagues on stage at the moment. Quick question or two for Nerivia. Thanks for the great presentation, very interesting. Nerivia, I'd love to hear your thoughts on what you think about potential mechanisms at play here. So I'm familiar with, and I'm sure you are as well, and this partially relates to the previous question about what explains these results, right? So in the literature on, in your words, contemporaneous effects, right? We think about constraints into participation, liquidity, insurance constraints, the childhood constraint, etc. But in your case, I think you would have to, of course, consider intergenerational constraints, right? Now, in some previous work of yours, I think you found some positive effects of the CSG on educational attainment. It's quite surprising then that this doesn't translate into improved labor market outcomes later on, right? And I'd be curious to hear your thoughts on that. And then a second quick question is a lot of work on the CSG by Catherine and Ingrid and others looking at contemporaneous effects shows some evidence of positive effects on recipient mothers, right? On labor force participation and employment, which of course contrasts with your longer term effects. I'd love to hear how you're thinking of translating that evidence gap there. Thanks, very interesting work.
Hi, great presentations. I'm Edson Severnini from Boston College, and I'm a senior research fellow here at UNU-WIDER. I think my question is for most of the speakers regarding the individual effects versus the effects for the community where they are. So basically at the scale. So there's some research, for example, on the Bolsa Família in Brazil that it might affect the local economic activity, creating jobs, even formal jobs, maybe not for the people who are the beneficiaries, but for the local communities. So I wonder if you have investigated those issues and if you can speak to those effects as well.
Okay. One question there.
I'm Leandro de Magalhães from Bristol. To Vinicius, about the Bolsa Família, the effect, you gave the average effect. Did you look at other than the average effect? It seems like these kind of shocks could be quite extreme value distributed, and then you could, a lot of people move a lot, most people don't move. It'd be nice to see if a medium or how, if you looked at that. And to Raghi about Egypt, what about zakat? Does zakat play a role? Does informal social norm rules, do they kick in at the 40th percentile, or there's some sort of role for the social non-formal transfers to help?
Thank you for the questions. I'll start with, I think, the two similar questions about the underlying effects, kind of what is the structural component to this. There's actually a lot of work that shows that the child support grant has positive effects on education, including my own work, as Tim mentioned, on health outcomes, positive effects on mental health, reduced teenage pregnancy. So all of those taken together, I really expected to see that there would be a positive effect on labor market outcomes. So I was surprised by the result. I think there are a couple of explanations for this. One is perhaps the cohorts that I'm studying don't have sufficient exposure. So the empirical strategy that I use here relies on variation by birth month. And so the data that I'm using has to have month of birth as well as year of birth, and that really restricts me to the NIDS data, which restricts the time period. It's already looking up until 2018. So I think it would be interesting to maybe use a different empirical strategy and look at this at a later time period with different cohorts who may be with longer exposure, and importantly, I think, continuous exposure. So most of the cohorts that I'm studying here had discontinuous eligibility for the grant, in the sense that they were eligible for some ages, then they fall out of eligibility, but when the age threshold changes, they fall back into eligibility. And so this discontinuous or uncertain eligibility could be a reason for why we're not seeing any positive effect. I agree that given what we know about the grant's effects on things that should matter for the labor market, like education and health, you would expect there to be some effect. But also, I think this result is not that different to what we know about other grants in South Africa, which is that the grants may be sufficient to overcome constraints to job search, but don't really translate into long-run sustained employment outcomes. So we see effects on participation margins, but really not seeing effects on employment margins. And that really has to do with structural issues in the labor market. And thinking about, what skills do people have? Are those the right skills for the jobs? What is happening with entrepreneurship and firm dynamism? And so I think those are the big issues. And I think that that's what we see in a lot of the work on grants, including the contemporaneous effects. And that's related to this question about, what is happening to these cohorts? Are they transitioning into education, or are they dropping out, and are we seeing employment effects? My other work shows that for the youngest cohorts that I studied here, those born in 94 and 95, there are actually positive long-run effects of grant receipt on enrollment and educational attainment in young adulthood. So these cohorts who were eligible during their adolescence for the child support grant are more likely to be enrolled and attaining education even after they are no longer eligible for the grant. And so that could be another reason why we're seeing no labor market effect, because actually these cohorts are still busy accumulating education. And so again, if we were to look at them later, if I pushed out the time period, maybe we would then see a positive effect. And then the last question on local community versus individual effects. I think, at least in South Africa, there has been a lot of work looking at the effects of grants, not just on beneficiaries or recipients, but looking at others in the household. And there is work that shows that the old age grant, the child support grant, does enable people to overcome some financial constraints, for example, childcare constraints or transport constraints. So it does affect participation. But again, this doesn't really seem to translate to employment, and really there we need to be thinking about structural issues in the labor market.
Okay, so first I'll start with Santiago's question about why is informality increasing or formality decreasing over time. And we looked at that question quite carefully. to see whether it is structural changes in the types of jobs versus it's happening within jobs. And the conclusion was, at least for the period in which there's a rapid decline between 2014 and 2018, it was all within jobs. There was no, very small part of it is due to structural changes. And the only two things that are happening during this period that seem to be notable are, first, the introduction in 2015 of the cash transfer program. So there could have been some incentive effects on formality. But the more important thing we believe that explains it is this concept of minimum insurable wage. Now, it's slightly different from the minimum wage. It's the lower bound wage that you can register a worker at in the social insurance system. A lot of employers would pay social contribution based on the minimum insurable wage, even if they paid the worker higher, but to reduce their contributions, they would register the worker at the minimum insurable wage. Now, if that minimum insurable wage is going up quite fast, the employers would think for the low wage workers, it's not worth the money, and so they would deregister them, and the workers themselves would, because they would have their own contribution also increasing. And so I think that that period saw a very rapid increase in this minimum insurable wage, which corresponds to increases in the minimum wage, but they don't quite catch up with the minimum wage. Now, there was a law change in 2021 where the contribution rates were decreased and the enforcement rates were increased substantially, the fines. And we still don't know the effect of this law in 2021, whether it's really reversed that increase. But in the last few years, it looks like the effect is much more of a structural change effect, but there isn't as much of a decline. Now, the other issue is that we looked at which workers had this decline in coverage, and it's low skill, low wage, very small micro and small firms. So those are the ones really where the decline is being perceived at the highest rate, would be most sensitive to this minimum insurable wage. Now, Haiyan, I would want you to kind of tell me your question again, because I really couldn't understand exactly what you're trying to get at. So if somebody else understood it, if you can tell me. You want to reformulate your question? Yeah. Yeah. Haiyan. Yeah. Yeah.
Thank you. Oh, sorry for not being clear. Okay. So what I'm trying to understand is that, given, the system in Egypt, right, or in developing country, well, for example, I'm looking at the chapter for Vietnam, looking at the system in Vietnam. So basically, I wonder, if poor households in Egypt are sufficiently covered or protected against, all the unexpected, like disaster, shocks, unexpected shocks, to the system, right? And compared to richer households, which have more resources, which by definition, have much better, buffer, right, against all the unexpected events. How could poor households, perform? How do they, protect themselves, right? And building up on that, I suspect that, in the case of Egypt or for most developing countries, at least in the case of Vietnam, China, some other countries, right, that we know. Poor household, they performed, basically they suffer, a lot during, like unexpected events. For example, the recent COVID-19 pandemic, right, where you see that, poor household, vulnerable population groups, they suffer a lot more, than the general population, right? So I just wonder, in the case of Egypt and other developing countries, right, could we quantify a bit, on the necessary, transfer or support that the government, can do to live up, on the poor households, so that they can be more sufficiently, protected. Sorry, it can be a complicated question, right?
That seems like a whole paper
but,
in itself.
I just want to learn more, from what in your experience for Egypt and other countries. Yeah, thank you.
Yeah. Okay, yeah, I mean, I think it's yeah, definitely the susceptibility of poor households to shocks is much, much higher, and we do document that in our data, but to what extent we can quantify the amount that they would need to protect themselves against these shocks, that's a little bit of a harder problem, and I'll think about it. Now, on the question on the zakat transfer, zakat is actually not that prevalent, and it's very also irregular. People pay zakat on very kind of irregular sort of frequencies. We have it in our data. We haven't really analyzed it much. I doubt it's going to really come even to be close to being to the public transfers, cash transfers. But I can look at it, but I doubt it's going to be that important.
Is that working? Okay, thank you very much. I'll try to be as quick as possible because we almost are time. So when we talk about costs of relocation, I think this is definitely something we're gonna try to estimate, and I think we can do it because we can have the geographical coordinates of where they live and where they relocated to. So I didn't have time to present, but we have a theoretical model when we try to think the relocation process, and basically we have wealth, income, social benefits, and random shocks components. And definitely this is going to be a way to measure how much they're spending and how much a social benefit could be even significant or not for this kind of decisions. Then I'm moving to the next question. Basically here we're comparing extremely and very poor households. So I think there was a question about comparisons to different characteristics of households thinking about income, but they differ from a very small margin, and basically we're trying to understand if the social benefit is this margin we're estimating here. Edson asked the question about the place of origin and community effect. I think this is really important. The next step when we are trying to understand better the places they live in and how is the work structure where the firms are located, I think this is interesting, but there is another heterogeneity that I see that we can explore. As I said, this is a work in progress, so we have a lot to explore in the future. And the last questions, I think the same way, we can definitely explore different ways to assessing this effect, but it's still, I think the way we're estimating the categorical extreme events, they still kind of like represent some discontinuities on how this nonlinearity of the effects should affect differently the different households.
Thank you. The couple of questions addressed to me. On the first one, to make linkages between informal work and the transition to more formal work. So in what I have seen, cash transfers alone may not be able to do that, but when there are these economic inclusion programs which provide cash, assets, some sort of training, coaching, business support, there what you can expect is a lot of people get linked to formal markets and over the long term maybe become more formalized. So that is possible. We find that in a few studies, but it's important to note that the strongest effects of those programs are usually not on the poorest. The poorest are not fully able to make those transitions. They probably still benefit from the cash transfers, and in the medium term, maybe their income also increases. But this big transition is probably more for people who are somewhere in between, who have some education, some asset base, they're protected against some basic level of, they have some insurance against the most debilitating effects of shocks. So that is one. The next question on the adequacy of shocks. So this is not linked to my review paper here, but in our broader work in social protection, I think ways you can try to think about adequacy is benchmarking a bit the benefits to the costs of living, differentiated. Also, if benefit structures respond to family circumstances, if they're adjusted for family size and so on. A little less popular or a little less practical, but theoretically possible is if you have tapered benefits, so richer people get lower levels of benefits and poorer people slightly more. If you can actually observe their welfare levels ex ante with a fair amount of precision and granularity, and there is space to be able to provide two levels of benefits. One way to do it is to say, there's a base benefit, and then there are top-ups for more eligible criteria that coincide with poverty. That is one way. Or, you do top-ups for people additionally affected by a recent shock that is temporary in nature. Those are ways to think about it. But in some cases, like, you were talking about COVID, someone who lost maybe 20% of their income because they have lower footfall versus someone who is completely, without any income, it's very hard to know this ex ante. So I think, it would vary very much by context. But we can have a fuller discussion on this, and there are some practices one can think about, and that may be useful in a particular question you're contending with. And lastly, on Edson's question, I think in our review, I think it's very well taken, this point that most of the studies that we review, typically tend to focus on the impacts on program participants, and not enough on, any wider effects, general equilibrium effects or local economy effects. But in some cases, I do think there can be some, apart from the cases that you mentioned, just giving households cash transfers can help them maybe take care of other people, or through solidarity networks and so on, the money can go far beyond the immediate recipients. And those are things we typically tend to undercount. On the other hand, there may be some negative effects. There's a paper by Shani Kandapal, which shows that cash transfer provision in some cases where markets weren't fully functioning actually led to inflation and lower consumption of nutritionally dense foods in certain areas in the Philippines. So, in our review, we were limited by the majority of studies that tend to focus on the effects on the treated, if you say, but I think the point is well taken that we should be careful of these second-order effects on non-recipients as well. Thanks.
Okay. Thank you very much. I think there's been a rich, engaging session. So please join me in thanking our panelists.